Everyone, I will be presenting on physical development in infancy, which for the purposes of this presentation, I've defined as ages 0 to 3 years old. So I'm going to start by going over the normative milestones of this age range, and I want to cover a few general notes first. First, caregivers play an important role in reaching these milestones. Infants are obviously very vulnerable and helpless, and in many cases require an appropriate environment, tools, and encouragement to hit their milestones, even when they're within their natural windows of doing so. So these windows of what is considered normal development can be quite wide, and infants are going to develop at their own pace. So it's only if a milestone is not showing by the end of a window that then further evaluation should be sought out. We do want to see babies hit all the milestones, even when they don't seem particularly important, because many are involved in a developmental cascade, and skipping some may have ramifications for other, more significant milestones later on. For example, head control must precede rolling over, and babies need to be able to roll before they can crawl. Generally speaking, babies move from reflexes, many of which they're born with, to more intentional movements. They develop in both gross and fine motor skills. Gross motor involves the big muscles of the arms, legs, and abdomen, while fine motor involves the small muscles in the hands and wrists. As I mentioned previously, reflexes are some of the first developmental norms to look for in infants. Some are present at birth, like rooting, sucking, and gagging, which are all needed for efficient feeding and blinking. And a few seem to be connected to safety mechanisms, like the swimming, startle, and Moro reflexes. The stepping reflex allows infants to practice muscle patterns and movements that will later allow them to move independently from their caregivers. Okay, so the next few slides are packed with information on all the normal infant milestones and the emergence windows associated with typical development. There's a lot here just for your reference, because I know every case is going to be concerned with different things. So I'm just going to highlight some of the main things in each section that tend to be the most talked about. So to start, between 3 to 6 months, an infant has really just started to make sense of the world and is starting to be able to focus on interaction and exploration now that they're convinced their basic needs, being fed, put to sleep, cleaned, those are all going to be met. So at this age range, we see things like visual focus on items of interest, social smiling, and rolling. Then between 6 and 12 months, muscles are really starting to develop, and babies can manage to sit unassisted, and they begin to crawl and stand. This massively accelerates development because suddenly the world is much larger and more accessible, and babies are motivated to keep growing in understanding and engagement with it. This is the stage where nothing is safe. Everything's going into hands and mouths, and baby needs a lot of attention and interaction. And at this stage, solid foods are introduced, and baby starts to learn how to eat. Oops. Okay, so from 12 to 18 months, babies get much more independent as they begin walking, develop better fine motor control, and enter the world of imagination. They can also begin expressing themselves more effectively by using actual words and visual cues. Then from 18 to 24 months, talking really begins and social interactions become more complex. They're able to focus on tasks for longer periods, and that allows for completed play sequences rather than just sporadic or unrelated events. And then finally, between 2 and 3 years old, babies transition to toddlers and have much more autonomy in their behavior and thinking. They're able to focus on more complex motor skills at this point and demonstrate cognitive gains in memory and processing. Imaginative play takes off at this point, and overall, they really just become their own little people at this point. All right, so I'm now going to address some of the more common non-normative issues. So infancy is often the time when physical developmental differences are first noted. So if a baby is consistently behind in achieving milestones or fails to reach them altogether or demonstrates extreme difficulty in performing tasks typical for their age, this would warrant further assessment. In most cases, this is going to be explained by something really benign and easily fixed, but in others, milestone delays can indicate a more serious diagnosis such as Down syndrome, cerebral palsy, brain damage, or vision and hearing problems. Issues such as these may be caused by genetic factors, physical trauma in utero, at birth, or in infancy, psychological trauma like PTSD, exposure to toxins like alcohol or lead, certain rare and serious infections, or deprivation of food or inadequate environment. Early detection of delays is crucial to establish adequate ongoing treatment and support for the child and their caregivers. All right, so now I want to address the practice items from our case analysis book related to infant physical development. The first one is regarding physical growth and the role of nutrition in development. So babies undergo very rapid physical growth. By the end of their first year, their weight has tripled and their height has doubled. And they need a lot of food to make this happen. So they eat around the clock to keep their little stomachs full. They need to be provided with adequate amounts of either breast milk or formula for at least 1 year. Solid food should be introduced around 6 months of age, but it shouldn't be the primary source of nutrition until after their first birthday. Their first teeth show up between 6 months and 1 year and are fully present by age 3. There is a risk of cavities, and that increases with excessive sugar and carb consumption, or if the baby is allowed to fall asleep with a bottle containing anything other than water. Both malnutrition and obesity are possible issues that show up in infancy. Malnutrition results from too little food or when specific nutrients are not offered or absorbed and leads to slowed growth rate and long-term cognitive delays. Obesity is caused by overfeeding or failing to offer healthy, solid foods. And then 60% of the energy that a baby gets from its food goes toward brain development, which we're going to talk about next. All right, so the next practice item is focused on brain development. So just like their physical growth, infants undergo really rapid nervous system growth as well. By the age of 2, their brains are already 3/4 of their adult size. Babies are born with billions of neurons already present, almost all the neurons that they will ever have, but they're small and unconnected. As the baby interacts with the world through its senses, neurotransmitter flow is triggered and pathways begin to connect. The neurons grow and develop their myelin coating, which requires fat obtained through food, and protects the neurons and speeds up neural pathways. And then already in infants, we see the concept of neuroplasticity emerge because the pathways inside a baby's brain change based on what they experience. So a little bit more on this neuroplasticity. Because it doesn't know what neural pathways are going to end up being needed, the brain overproduces neurons and connections during the first 2 years of development. This allows for effective pruning of unneeded neurons based on life experiences. And then also brain development occurs in stages, both pre and postnatally. So the timing of any modifying experience that triggers this plasticity or any like environmental stressor is important when considering the potential impact. It's kind of similar to the teratogenic influences on developing fetuses, like if the mother is exposed to tobacco smoke at certain stages of fetal development. So when the stressor occurs, really impacts what part of neurodevelopment is affected. Okay, so picture a brain. You see something wrinkled and kind of like a walnut, right? That's the wrinkled cortex of adult brains, but infants are born with much smoother cortexes. As neural pathways grow and develop, the cortex is forced to wrinkle to accommodate the new growth inside the limited skull space. As we've been talking about, experiences which are based on sensory input in infancy dictate which neural connections strengthen and which are pruned away. So the more familiar a behavior is, the more efficient it becomes. The prefrontal cortex also develops rapidly from 6 months to 2 years. This is the part of the brain that manages emotions and allows a person to respond to other people's emotional cues as well. Social interactions in infancy are crucial for its development, and the way caregivers interpret a baby's expressions and behaviors and then verbalize those interpretations influence how the prefrontal cortex develops. Something interesting about infant brain development is that they must be in the right state of mind for learning to happen. This is because of the stress hormone cortisol, which shuts down non-essential brain functioning, including rational thinking and memory needed for learning. Thus, a baby that is distressed will not be able to develop appropriately and is likely to experience delays. So the final practice item from our textbook is concerned with infants' sensory abilities. We've been discussing how experiences shape development, and senses are what allow infants to have these experiences. Sensory input is required for an infant to begin perceiving and categorizing the world around them. Caregivers can foster this by providing toys that stimulate the senses or motivate exploration. I'm going to briefly talk about what the development of the individual senses typically looks like, starting with vision. Newborns tend to cross their eyes for the first several weeks and have a very limited visual depth, just enough to see mom's face while nursing. This slowly increases and depth perception develops so that by 4 to 8 months, eyes typically focus equally and babies show signs of body-eye coordination. Vision development can be encouraged using visual stimulants like mobiles or contrast cards and playing games like peekaboo and patty cake. Hearing is one of the earliest infant senses and is actually fairly developed already in the womb. Babies show a preference for their mother's voice at birth and familiarity with other people who they heard frequently while they were in the womb. Hearing can be further encouraged using music and vocal engagement and can be negatively impacted by ear infections, loud noises, family history, and birth defects. Smell and taste also develop quite early and are likely practiced in the womb. Breastfed babies show recognition of their mother's scent, and as babies encounter solid foods, they typically show a natural preference for sweet tastes. Caregivers, therefore, often have to repeat exposures to other flavors many times before the food is accepted. Taste development can be encouraged by offering a variety of foods and providing toys appropriate for oral development through mouthing the toys. Babies tend to put everything in their mouths, so caregivers need to be alert to choking hazards and toxins in the environment. Finally, touch input is essential as babies map their worlds. To encourage touch development, a variety of safe objects can be placed within the infant's reach. Babies show response to both comfort, like a caregiver's hand on their back, or pain, like an injection. So to conclude, there is a lot happening in a baby's body during these very busy early years. Physical development is actually quite predictable, so variations from the norm are some of the very first red flags of impairment and should be discussed early and often with care providers. Finally, achievement of physical milestones isn't just something that's intrinsic to babies, but rather requires caregiver input and interest to succeed. Thanks for watching.